everyone. This is Pam Reese with Adventures in Aging, and I'm here with my friend
Gary Vandenberg. Pam, it's great to be back again. Just want to start by thanking our sponsor, StrideLite.net. StrideLite provides quality diabetic shoes, custom inserts, orthotics. Please bring up to your doctor or podiatrist the best solutions for your foot needs. Thank you, StrideLite. And as part of StrideLite, the person that owns StrideLite, his mother, Joan, was actually my business partner many years ago.
That.
And she passed away several years ago, but today is her birthday.
Oh,
so
happy
I wanted
birthday,
to extend that. And the one thing that she did, taught me, and, she always focused on growing the good, if that makes sense. And we worked together in nursing homes and retirement centers and always focused on finding the good in people that live there, people that work there. And I just, contribute to honor her and thank her. What is our topic today?
So, Gary, today is a topic that will touch every single person listening. It is making the most out of your doctor's visit.
Isn't that something? I've recently been to the doctor more than I wanted to.
Right.
And so I can relate to this topic a lot.
So, Gary, the thing is that we visit doctors from the time we're born until the time we die.
Right. And, there's routine visits. That's what I usually do. But there's times you go because you get a problem. You
right.
get something that's concerning you.
Right. We're either going for that well visit, that checkup once a year, or we're going because we have an acute problem, right?
Yeah,
that we want to go find out what's wrong with us. But there are different thoughts and different feelings about visiting your doctor, and about your doctor's voice, right? Is it always right? Do you always trust your doctor?
Well, sometimes I had a bad experience with a doctor that did me wrong one time.
Tell me.
Well, I had a staph infection. What I had was a bump on my back.
Right.
So I go to this doctor, a family doctor. I was like 16 years old, and he probably did the worst thing you could do, and it made it 50 times worse. We never sued him or anything like that.
Oh, my gosh.
But it ended up being this huge staph infection, like a hole in the middle of my back. And,
yeah.
And I go back to what he did. Caused that. Does that make sense?
Oh, yeah.
And these days, probably somebody would have sued him or something like that.
Absolutely.
But and then I've got, I always wish doctors would come out and say, Gary, you need to lose 25 pounds. See, they never say that. I think I've asked them, hey, tell me to lose weight. And they say, well, your age and your lifestyle.
So you've never had a doctor be that frank with you?
No. I wish I had a Frank doctor.
I wish you would have. I mean, not because you need to lose 25, but
Dr. Frank.
Yeah, Dr. Frank needs to tell you. So there's a lot of people, when they go to the doctor, they take that doctor's voice as gospel.
Oh, absolutely.
Right? Because the doctor said. I know my parents, well, he said, the doctor said, I'm just following the doctor's advice.
Right.
And I'm not saying to anyone, don't ever not do that. Always take your doctor's advice. But something interesting to talk about is your rights. The patient's rights when they see the doctor.
I didn't even know we had rights to see a doctor.
We have rights. They are the patient basic rights. And let me just go through a couple of these. So everyone, when you go to the doctor, know this. You have the right to information about quality. Do you ever, not that you walk in and say, hey, tell me how good you are, but you have the right to research your doctor. You have the right to look at reviews of your doctor.
Yeah. There's is it WebMD? I know that's a website. There's probably other ones that you could look up and see.
Yes.
Their names, their background, who's in their practice.
You look up their credentials, their statistics, what hospitals they affiliate with, what health plan they cover, and is their language your language? Okay, that isn't always necessary, but for some individuals, you want to speak to someone that you understand and that they understand you. You also have the right to choose a healthcare provider. Now, with the different insurances and all of that, it doesn't always make it that easy, right?
Right. Yeah, we've switched mainly when we're moving. Obviously, if we move around, you get a new doctor. But if you lose your health plan,
it's a huge dilemma when that happens. But if you want to go see who you want to go see, unfortunately, you might be paying a different cost, right? Yeah. Which that's a whole other topic. You have the right to emergency services. You can never be denied a treatment in the emergency room.
Okay. All right, that makes sense.
Yep. The right to make decisions. It's up to you to decide which course of treatment you want to follow. And it's up to you to decide Am I going to take this doctor's advice or am I going to go get another opinion?
Wow.
And so the rule of thumb is if you have a gut feeling that says, wow, I don't know if I want to do that. I'm not really sure I like what was just said to me. Go see someone else. Get a second opinion. Okay. Get a third opinion if you have to. And just always remember, it's your life. It's your body.
Yeah. Well, but, there's also a denial that people don't always like to hear what they hear. Do you know what I mean? And
100%.
Going looking for a doctor that tells them what they want to hear, which is unfortunate. So.
And so also it has a lot to do with your doctor's bedside manner, right?
Oh, absolutely.
Some doctors have a presentation that is so empathetic of your needs that truly talk to you in a manner in which you're able to understand and it makes you feel comfortable to talk back, ask questions. Right. And then you have some doctors that are so matter of fact and it's almost as if they don't have a sympathetic bone in their body. So you also have the right to be respected. You have the right to confidentiality. And of course, we all know that. That's the HIPAA rules and all that. That's why everyone has to sign the confidentiality clause when they go see their doctor. You have the right to complain.
Okay.
So if you feel that you're treated badly, if you feel that you've had a bad diagnosis and you find out something different later, if you have an overall bad experience, you can talk to your insurance provider, whoever that is, about your physician.
But it's kind of a two-edged sword, though. I know I seem to get a lot of tests. Does that make sense? That I don't seem to ever recognize as being that critically that we needed to do these tests. But don't you think part of that is to cover the doctor's malpractice that they trying to overtest you at times?
Doctors have to carry a malpractice, and they're very cognizant of the steps they take in making a diagnosis. And I think a lot of times it's about ruling out, right? You rule out a problem. So you present with certain symptoms. I'm going to go with the worst diagnosis, and I'm going to rule that out. And then I'll go to, well, maybe it could be this, and then I'll rule that out. And actually, those are the best steps to take.
So the worst case scenario, working your way back to the best case.
Absolutely. Okay. So I can just equate that like to my dad. My dad had swollen lymph nodes. They didn't bother him. They didn't hurt. It was just starting to be more of a cosmetic type of thing. Like, Dad, why are your lymph nodes swollen? He went to an urgent care, and at the urgent care, the doctor there just said, well, you obviously have a infection. Put him on antibiotics for 10 days. This nodule kept growing. Dad went back to the urgent care doctor, and I'm a nurse, Gary. So, I'm the nurse in the family and sometimes the, makeshift doctor in the family.
Right.
My dad wouldn't listen to me, right? Because I knew better. I knew what he needed to go do. And again, put him on another round of antibiotics. And finally, my dad went and saw the right doctor, went and had a biopsy, found out that he had non-Hodgkin's lymphoma. And so in that case, he should have had all those tests. Okay.
Yeah, that's but as we get into our topic today, making the most out of your doctor's visit, I'm sure there's certain things we can do. And really the bottom line is to make this successful, right? If you're going to the doctor's office, why don't we make our time and our communications as successful as possible?
Right.
And so what comes to mind? What types of things come to mind when you think about that as things that we want to do kind of ahead of time as we kind of plan ahead for the visit? So
it depends on your visit, right? If you're going for the wellness visit, nothing, you're feeling fine, but you want to make sure you're okay. If you have a concern, if you're worried about something down the road, talk to your doctor while you're in the office that day. Take notes, right? Pull out your notes. It's okay to do that.
I think notes is probably one of those things. I know I do. I just scribble down 2 or 3 things that I want to bring up if time permits, and then I kind of prioritize them. I kind of say, if I only have so much time, I'm going to say this, I guess, and and the other things are kind of weirdo kind of stuff.
So a different type of doctor appointment is when you're taking your children to the pediatrician, right? As a mom, as a dad, you take your children. And I just know from my end, being a nurse my whole life, I didn't even tell my pediatrician initially I was a nurse because I asked every crazy question you could possibly ask when I had my children. When my daughter was born, and I just had so many questions about this newborn baby, and I didn't want him to think I was ridiculous or didn't know my field. But I've learned over the years, it's okay to ask all those questions regardless of your background.
Yeah, no, asking good communication is all about it. In fact, there was a study here that said it found 75% of doctors believe they communicated satisfactory. 75% think they're doing a good job, but only 21% of the patients felt that they were doing a good job. Isn't that crazy? That's like a 50% gap.
Yes. That is so amazing. Communication is such a big deal between you and your doctor. And Gary, if you look up Dr. Webb and all these, there's many, many sites to look up the rankings of your physicians. And so many people rate their doctors according to their listening skills.
Yeah. Well, in fact, what they found in one of these other studies was that over 80% of diagnosis can be made by just listening. If the doctor just gives you the time to listen, you could probably explain some things that would help them better understand. But the world's rushed these days. In fact, there was a study done that showed after 12 seconds, can you believe the typical doctor, they must have, figured this out somehow, but the doctor would stop and interrupt the person. Well, let me just, ask you if you, can't you see him butting right in and or her butting right into the conversation there?
Yeah. Unfortunately, that does happen. But again, just keep in mind, everyone, they work for you.
They work for you. See, I never think of it that way.
Yeah, that doctor works for you. You're paying that doctor. Your provider is paying that doctor.
Yeah,
and you're paying for a service. And people don't often think of it that way.
I think I'm from that old school that there's God, and then the next people down is probably doctors.
Really?
Right? Isn't that funny?
Yeah.
Because they're saving lives. They save people's lives every day, don't they?
They do.
And so I think and they go through so many years of schooling and training and the details of our bodies and how they work.
So just like any profession, Gary, let's take auto mechanics.
Well, they're next to God, too. I mean.
Right. They're important in life just as much. There's good ones and there's not so good ones.
Yeah, okay.
Right?
Yeah.
You might take your car all the time to Joe down the road, but Sam lives right next door to you. But he's not as good.
Right. But do you think they're rushed because there's not enough doctors, or there's too many patients, or a little bit of both? I'm always wondering why there's.
Well, there's not too few patients. They're rushed because it's a business. I mean, I hate to say it, but what is the average? 11 minutes visits. Every 11 minutes, the average doctor is scheduling an appointment, or their assistant is.
But I think there's, it's just each doctor don't they have like hundreds, if not thousands of patients, right?
They do. They have to fit them all in.
Oh my gosh.
Sometimes they are hurried. However, do you ever go to the doctor's office and you're sitting in that room with the door closed for an hour before they come in to see you?
I've had that, yeah. Or sitting in the waiting room waiting for forever, hours, it seems.
That's a bad review. But on the other hand, if you have a doctor that's spending quality time listening and communicating with their patient, that doesn't go unnoticed, but there's other ways to do that. There's consultations and phone calls, and you never want to feel hurried.
And when you think about some of the challenges there, obviously there's cultural challenges. People are from different backgrounds and different settings, and even language barriers. I was thinking about that recently. That there's a lot of people that don't speak 100% English. They speak other languages, and you get in situations where it's difficult to probably communicate with somebody in a different language.
No,
right?
Absolutely. And then you want to try to decrease your anxiety, right? We all want to self-diagnose.
Yeah.
And so, for instance, for me, I get a pain, I get a headache, and I think, well, there's that brain tumor. Not to downplay that, but don't go there. Don't go to the end horrible result before you go see your physician and have diagnostics.
Yeah. And I'm sure there's embarrassing things that people don't always want to bring up.
Oh,
right?
100%.
I hope it goes away.
Well, I got to tell you what. I worked in the emergency room for a number of years when I was first out of nursing school. And I could tell you hilarious stories about the patients that would come into the ER.
Okay, yeah, I'd imagine some of those are
and very embarrassing.
Embarrassing situations like that. But I was also thinking, the doctor themselves has they do have some level of humanity, so there is a connection with people, right? They must feel that they want what's best for you. I kind of come from that angle.
So you would hope so. I would hope that every physician has that feeling. But again, they're people, they're individuals, and some bring that human touch, that heart touch. Some don't have that as well, but really have great diagnostic skills. And so you have to weigh what is important to you. And I think that's the bottom line. What do you expect from your own physician?
Yeah, and so that's going back to that list or those priorities when you're coming in as to what you are going to be covering. So I think it's important to have kind of an agenda there. But as you said, it's probably finding the right doctor too. And it's how do you find the right doctor? I guess if you felt like you had the wrong doctor, what suggestions do you have of looking?
Yeah, so I think I'm just going to go right back to the doctor online reviews. Yeah, honestly, if you just put in a doctor's name, the reviews are going to come up. If you Google that, but also hospital systems, they list all their physicians.
Yeah, or asking other people.
Or asking your friends who they would recommend is really a great idea. You can find some of the best doctors by just asking around.
Yeah. Now, have you ever taken someone into the doctor's office with you besides your kids, I'm saying?
Right.
Or grandkids, is like the companion. Well, what do you think about something like that? Having somebody go in and listen. For me, my wife, she went to college in medical technology,
Yeah.
so she's the medical person.
She goes with you.
So if something's serious,
Yeah.
she invites herself in with me to kind of
Sure.
her and the doctor talking. I'm kind of the third person in the room. What I'm saying, like that.
So I have gone with, I think, all my family members at a time or two, because of just to listen and to ask the right questions of the physician. Because they didn't feel that they would be able to articulate how they felt. And I know that when I would go to the doctor's appointments with my mom and dad, I would have that doctor sitting there for a very long time, going through a whole series of questions.
And I think, when you're talking like that companion person in there, they may be listening a little differently than you. See what I'm saying?
Right.
I hear only what I want to hear, right? Whether it's good or bad, but that other set of ears is hearing reality. That can probably tell me afterwards. No, they didn't. The doctor did not say that. The doctor said
always
this.
Right there. I got to tell you, there's a name for it. I can't remember it. Where the person that hears the doctor speaking walks away and only heard the most negative part of it.
Yeah, or the most positive.
Right, or the most positive. Yeah. And then it takes that other person to say, no, that's not exactly what they were saying.
Right, or to remind you later, too, hey, remember we went to the doctor's office and he said you should change this about your life or follow or take these pills or not take that. And, it's those types of things. But I'm sure there are certain things that we should do, again, before you come to the office, as we said. One thing I was thinking about recently was if you have a test done, to make sure that they've received it. Doesn't that make sense?
Oh, my gosh, right. So a lot of the hospital systems today and the physician offices have shared electronic medical records, right? It's more common than it's not. Still to this day, you can go to your doctor in a large system, and it might be your first visit, and you might be still within your same system. They were supposed to transfer EMR, your medical records, and you get there, and they didn't come yet. Right. There are those glitches. So always call a few days before your appointment. Hey, did you get?
Yeah.
Do you have? Yeah,
that was something I think sometimes we don't think about. And also just making sure you have all your information, they always ask for the same thing, don't they? They ask for your driver's license, your insurance card, certain things like that, a list of medicines. Those are the kind of things that, I don't have. I take a couple medicines, but it's the idea of they're going to ask me. I better write these things down and bring them with me.
So my husband just talked about this, just had an experience where at the doctor's office, you got to give your information, right? And they have to update it. And so you're writing down all the list of your medications, you're writing your history, your all that. Then the assistant comes in, sits down at the computer, and starts asking you again.
Yeah, the same
Why are they not sharing this information?
Right, and we're still handwriting this stuff on a clipboard.
So there are some frustrations.
And I think the other thing that's, with technology today, what's interesting is we go on the internet and we look up stuff, right? Isn't that
Oh my
crazy?
gosh, I just want to caution everyone listening, be careful about that. The internet's full of great information, but it'll also scare you to death, or it will minimalize something that shouldn't be. So be very careful. Everybody wants to self-diagnose. Everyone wants to diagnose their loved ones. And unless you're a professional and you have diagnostic skills, I'm going to just say don't do that.
I wonder what doctors think of that. Do you know what I mean?
They do it too.
Oh, they do it too?
Oh, absolutely.
But I'm often thinking, I wonder if when they're doing this, they're coming in and somebody comes in and says, oh, it's the end of the world. I got this rash, and it's going to kill me. How do they not
what?
Get
Say,
get
I
angry
agree.
or those types of things?
They're so used to it. Everyone's the backstreet doctor, but not backstreet, back seat, like a backseat driver.
Right.
So a backseat doctor. Everyone thinks that, I think I know what's wrong with you, kind of thing.
Yeah. So if back to that list there, I was thinking, it'd probably be a good idea to have a little bit more detail in it, right? As far as like, when did this happen? Where were you at? Did it happen? Something happened because of something you were doing. If I was playing, catch football in the yard and I fell on the ground, that might be a different thing than just me sitting in a chair and all of a sudden my back hurts or something.
Yeah. So do you ever notice how the person, their assistant, the med tech, the nurse that comes in first and takes your vital signs, a lot of times they're going to ask that. What were you doing? How many days has this been going on?
They get the basics.
They get the basics.
Okay. And so, and they also want to know if this is something that you've had for a long time. Is it something new? Is it, how describing it?
So you know what the theory is. The longer you've had it and you're still okay, it's probably nothing too serious.
Oh, okay.
Right?
I never knew that.
Yeah.
I guess I always thought it's finally gotten to that breaking point, the straw that broke the camel's back or whatever.
So I used to hear people say, older people than me say, well, I have my old pains, but then I get really nervous when I have my new pains.
Oh, okay. And then I'm sure there's things people do that, maybe ease it. Maybe if they do it this way or that way, it actually makes the whole symptoms go away or minimize them,
Well, you always want to know, does the Tylenol work? Advil work? Does the decongestant work? And the whole rule with your health is, do you feel better today than you did yesterday?
Oh, okay. I know that there's different tools that doctors actually are trained to use, and some of these may be, updated or outdated. There's one called AIDET. Did you ever hear of AIDET?
No, tell me.
And I think that's, for doctors' sake, it's acknowledge, introduce, the duration, which is allowing adequate amount of time to talk. This is, again, during your storytelling. E is for explanation and thank you. And the whole idea is that if doctors have that built into their brain, and maybe that's something they spend 10 seconds on in medical school to do something like that.
Yeah.
And then there's another one that's called respect. And that stands for rapport, empathy, support, partnership, and explanations, cultural competence, and then trust.
I think respect.
Respect.
I think that's the most important one.
Okay. And you stop and think these are basic little kind of things there. And there's also, 4 E's. I came across this. The 4 E's. Did you ever hear the 4 E's?
I don't think so.
Let me see if I got them down. Engaging, which is building rapport with the patient, emphasize or empathy, right, with them, educate them, and then enlist them, which is inviting those under their care to actually take part in their planning of their care. It's enlist other people to also help with them going forward.
And just always keep in mind, don't be around the negative people that are going to put you at death's door, and you're not ready to be there. I've heard this before from others, I haven't been feeling, my friend was feeling like that. And then they had, some horrible diagnosis, and nobody wants to hear that.
Absolutely. Boy, that is the truth. And, I think there's a lot of self-fulfilling prophecy, right? If somebody says you should feel lousy, you start feeling lousy, right?
No, exactly.
And if somebody says, it's not that bad. You should kind of get over that.
I got a little story to tell about this. So last year, I worked with buildings or with facilities, nursing facilities where there were COVID outbreaks. And ultimately, I got COVID, even in spite of all of my interventions and doing everything right. I did have COVID, but didn't know it at all until I was tested. And because I'm in healthcare, I had to be tested. So that's how I got my positive diagnosis. Thank God I was one of the people that really didn't have any symptoms. But I can tell you what, just from the news, hearing about COVID, hearing about ventilators, seeing all the death and destruction, I was waiting for any minute to just go into respiratory arrest.
Keel over.
Yes.
This was your
psychologically, that disease was horrible.
Isn't that something? You remember cancer was that for many, many years. People say, oh, my aunt's got cancer. Oh, sorry, she's going to die.
I know.
And, now people live their 20, 40 years with cancer.
100%.
And isn't that something how that kind of deals with those kinds of things? I think going back to some of the just questions, it's good to ask, when it comes to test, I think it's always, and I found myself recently bringing this up also, just saying, what is that test? Why am I taking that test? What's the result of the test? How long is it going to take to do this test?
Yeah.
It's those types of things.
So, anymore with EMR, electronic medical records, and your patient chart, how you can sign up now with most physicians to get your patient chart. You can go and get lab work, and it will show up on your chart that you can get into before you get a call from the doctor.
Oh, wow.
So be careful interpreting your results.
Oh, yeah. They call me after these test results, and I have to write them down to ask my wife.
Oh, you don't have the My Chart?
No, I don't. I should get that. But
you really should.
But, they're saying, cholesterol's this, triglycerides that. I'm just writing. To me, they still don't mean any numbers. Does that make sense? It's like, tell me which the bad thing.
You want to know how high you are or what that means to you.
Yeah, those types of things.
You want to know what normal is.
I want to know what normal is. So that's always important. I think also when we think about, being with our doctor, how important it is to just, again, be honest and straightforward. I don't think it solves anything to kind of hide things from them.
So people try to hide stuff from the doctor all the time. If somebody has a glass of wine every night, I'm not going to tell my doctor. Smokers, I'm going to tell them I don't smoke. People that never work out, or aren't active are going to go in and say, oh, yeah, I run 3 miles a day. Yeah. Don't do that. Just be who you are. But I'll tell you what is what's the negative with that. Some people don't tell all that because of their insurance.
Oh, do they? Okay. I was thinking more.
If you have comorbidities or you have an inactive lifestyle, sometimes, your insurance carrier, it rewards the healthy person.
Oh, yeah.
The healthy lifestyle.
I had one of those insurance plans that you had to document everything you did to stay healthy.
So it kind of forces people to make some stuff up.
Yeah. What did you think? Years ago, we had Kaiser, I think it was. Is Kaiser still out there?
I think they are, and,
and they're
big.
They were into preventative. I was going, more for these preventative tests where they, come in, I'm healthy. Yeah, we want to keep you healthy. They were checking everything out to say.
Did you ever have one of those physicals that you do the stress test, the EKG, they test your arteries, your carotid arteries? I mean, it's a very in-depth physical.
Yeah.
I have had those, and honestly, Gary, I think they're great.
Yeah.
I want to know stuff. Like, there are people they don't want to know.
Oh, yeah. No, I can relate. I've had that not that long ago, and, I guess I never looked at my heart before. I'm laying there on this gurney, I guess, and looking at my heart going, man, that thing's been pumping my whole life. Isn't that pretty amazing?
No, it is amazing. The human body is amazing.
Pretty amazing there. Yeah, and it's quite interesting to think that they can take pictures of the inside of you. I'm still fascinated by that whole thing. And so, I think at the end of your session there with your doctor, don't you think it's important to kind of clarify, be on the same page? And
yes.
I should do more of that. I kind of just smile and head out the door.
Do you? You just say okay and leave.
Well, now they have they print out my visits, so that helps. But, they also include things when I was 15 years old on this record. That's many, many decades ago.
Oh, that's another thing. So let's talk about that super quick. Make sure you update your medical information. You don't want to be on Seinfeld. Do you remember the show where Elaine had all kinds of stuff on her medical record, and then she was blackballed from a doctor's appointment all over town.
That's hilarious.
It's hilarious. But so, for instance, if you haven't been to the doctor in a while, but you've been going to the same, healthcare system or the same physician for a long time, and all of a sudden you see all your diagnoses, they're stacked up from 15, 20 years ago.
That's what I said. I had an allergic reaction when I was like 16 years old to codeine, right? Finally, I said, take that thing off of there. I took codeine once in my life when I was 16 years old. I don't think I'm worrying about that now. But what's interesting about Clarity, again, they did a study. These are at University of Washington, found that doctors only 1.5% of the time, 1.5%, that's pretty small, isn't it?
Yeah.
Ask patients whether they understood what was discussed during the appointment. 1.5%.
So before you leave your doctor's appointment, are you saying the doctor should say, do you understand? Like literally say those words.
Almost like tell me back what's the next step or something that they can leave. Yeah, I probably falls into that category of, I can't recall the doctor ever saying something, recapping it to me. It's like, have a nice day.
Oh my. Yeah. So I've been fortunate. I've had a lot of really great doctors in my life. I've had a couple that weren't so great. And I'll tell you what, Gary, after that first visit, and I didn't think they were great, I never went back. I just said no.
Well, I asked my wife, some questions as to what she would do. She's much more into this doctor things with her mother and also our kids over the years. And so I said, what would you think comes to mind? She says, why don't you, the most important thing in her mind is do what they tell you to do. Right. Isn't that funny? That a lot of people don't want to do that. They don't necessarily trust or follow what people are doing.
Well, you have to trust, right? You have to trust your doctor. And if you do have a question, get a second opinion.
Yeah. And I would think that you could trust your doctor because I think if you don't, you shouldn't have that doctor, right?
100%.
If there's something that's going on.
Yep.
The other thing that I think is important is also before you leave to schedule things. Doesn't it make sense that
my gosh.
You don't want to be going home and then there's phone calls and callbacks and this and that.
Okay, nothing's more frustrating than, hey, we need you to go have a colonoscopy. Call, this, or they'll call you tomorrow. A week later, you're still waiting for them to call you.
Right. Yeah, and I've had that, or else, the other thing, it's probably out of their control. Hey, you need to go get that checked out,
Yep.
But nothing's open for 3 months.
Right.
And you're sitting there going, well, if it's so urgent, why is it taking 3 months to see me on that?
No, I totally agree. I have a friend who had a mastectomy not long ago, and she had just a minor complication, and she had to get it taken care of, but the surgeon was on vacation the next week and couldn't do it. And I'm thinking, what? This isn't something you think I should have done?
Yeah, that's that important there. And also make sure you got the contact information. And I hadn't thought about that till we decided to do this podcast, that, it's important to have your doctor's name, have a phone number on them, how to reach them, who's the backup if they are on vacation, who else is in the office if there's a second person that you want to make sure you've got all that information on them.
So, Gary, do you know there are a ton of people out there that don't have a personal physician?
I didn't know that.
Yeah, there's just tons of people that don't and rely a lot on ERs and urgent cares. But at the end of the day, trust who it is you're going to. Be open and honest about your symptoms. Be a good listener, but also be a good question person as well. All right. Well, Gary, anything else on the doctor visits?
I think we're out of time today, Pam.
I think we exhausted it, but there's probably still a ton left. So anyway, I want to take this moment to thank all of our listeners. Thank you for joining into our podcast. Please share our podcast. Please rate us if you like us. Rate us high. Gary and I truly appreciate it, and we'll talk to you next time.